Good evening. Welcome back to the Ask Me Anything with Dr. Twyman, helping you guys try to become heart attack proof since at least 2019 when my practice of cardiology opened in St. Louis, Missouri, working with patients from all over the country and also the world. Just saw somebody from Canada again last week. So if you're interested in trying to become heart attack proof, you can either follow me on my school community or come see me in person at Apollo Cardiology. The only other housekeeping I have for tonight is that I did add a couple links to my bio so that if you're trying to find the school community or you're trying to find my YouTube channel where all the archives of these older IG lives have lived, it's on my YouTube channel. So those links are now in my bio on Instagram. So for those that are part of the school community, they had an hour-long AMA with me last Friday. We talked about lean mass hyperresponders, talked about the Connect QT device to look at central blood pressure at home, talked about some of the benefits of different nitric oxide supplementation. So if you're interested in more of these kind of deep dives on these cardiovascular questions that you guys ask me on Instagram, the school community is where a lot of people are getting further deep dives for that. So there's a free 7-day trial. Check it out if it makes sense to you. Stick around. We're going to do some lives there as well. Have a couple courses on how to become heart attack proof, how to read your own labs. And then it's the community where people are sharing what their wins are, and it's always interesting when people listen to some of my circadian biology recommendations and their sleep starts improving relatively rapidly. So that's the school community. So with the housekeeping out of the way, we'll jump into the questions tonight. So the first question up tonight: do I worry if my LDL is high and my LDL pattern is, I think it looks like, is type B, but their LDL cholesterol is only 79. ApoB looks like it's 80. What can I do to lower it? So a lot of data points. Always start with what's going on with your vascular health. Do you have endothelial dysfunction? Do you have plaque in your arteries? Have you had a cardiac event? Do you have a stent? Have you had bypass? Then lipoproteins likely should be lower. Initially look at ApoB. ApoB should be at least less than 70, probably optimally less than 55 in those high-risk individuals. After you look at ApoB, then you can look at the particle number and size. The smaller they are, they tend to be more likely to get oxidized and damaged. The smaller ones sometimes are genetic, sometimes are due to insulin resistance, and you follow up with other testing to find that. The pattern AB, it's still reported on many of the packages. It's not that useful after you look at the ApoB because that's what really predicts risk from a lipoprotein standpoint. But give you an idea if it's going to be more genetic or more metabolic. Are heart palpitations the same as tachycardia? Not necessarily. So palpitations are just abnormal heart beats. Tachycardia is a heart rate greater than 100 beats per minute. Normal heart rates are generally between 60 and 100. If it's under 60, that's bradycardia. If it's greater than 100, it's tachycardia. Palpitations can be due to abnormal beats in the top chambers. So it could be premature atrial contractions, premature atrial tachycardia, supraventricular tachycardia. You can have heartbeats that are below the atrial ventricular node. Having premature ventricular contractions are not uncommon. So a Holter monitor is probably the best way to catch what is causing the palpitations. And then you can work with your doctor, or if you work with us, we get to the root cause of why you're having those palpitations and try to suppress them. So he's asking if I can make a YouTube video on blood pressure and how it changes throughout the day. I've done this previously. There's some videos on my YouTube channel talking about circadian changes in your vascular system, but that's something I potentially would do. I'll probably honestly put it in the school community first and then release it later to YouTube. But generally, blood pressure is going to start to rise between 3 a.m. and 5 a.m. The blood pressure will continue to rise in the morning. It's going to plateau in the mid-afternoon and start dipping in the evening time. Overnight, the blood pressure should drop by 10 to 15%. If it does, great, you're a normal dipper. If your blood pressure does not dip, that can increase your risk of stroke and heart attack. Sometimes it's due to sleep apnea. There's some other reasons that you may want to affect treatments if you see somebody as a non-dipper, you may change up if they're on medications or supplements to lower their blood pressure. You may start using those more in the evening time instead of taking them in the morning time. Question: what can you do to take blood pressure if you have white coat hypertension, even at home? So even if you have blood pressure elevations at home that are considered, quote, white coat hypertension, which the classic definition is that you only have high blood pressures at the doctor's office. So if you're having it at home, you have true hypertension. So if your blood pressure is consistently greater than 120/80 for any reason, you got to figure out what the root cause is and treat that. Sometimes it requires pharmaceutical intervention to do that. But to truly diagnose white coat hypertension, you need to use a 24-hour ambulatory blood pressure monitor that will tell you your blood pressure load and will tell you, what is going on with your blood pressure. If it's, due to stress, then manage your stress. Vagal nerve stimulators, biofeedback, mindful practices, meditation, the respirate device can help with the vagal tone being improved and treat white coat hypertension. I respond well to the cuff going inflated. Those devices, we have it called the ApoB. It's more like a monitor that sits on your chest and non-invasively measures your blood pressure. You don't even know it's taking it. Sometimes that's what we use for people who have really bad white coat hypertension. Is creatine good for heart health? If so, how? Creatine is very important for kind of just general skeletal muscle health, but I've not personally seen any data that's that useful for heart health. Wouldn't be surprised if there is data out there, just not aware of it. Generally a safe supplement for most people to take, but generally, don't go over 5 grams unless you know what you're doing. It can cause some GI upset, but if you're on higher doses than that and it's not causing GI upset, there's no really downside to taking it then. All right. Glitching on the Instagram here. Won't let me close this one, so let's see. Got the new iPhone, and for whatever reason, running it tonight, this last question is still stuck at the bottom of my screen and won't let me clear it to get to the next one. So give me a second to see if I can clear this. If not, I'm going to have to stop the live and try to fix it otherwise. But let's see. Maybe I can click something else up top. Nope. Still glitching. So while this is going on, if somebody has a question, put in the comments. I'll try to answer that one. I'll try to figure out how to clear this from the bottom of the screen. All right. Well, it's still glitching with that, so what I'll do is I'll just close out. Sorry, log back on, see if that clears it, guys. So give me 2 seconds here.